Jason Bahamundi. I am the founder and one of the co-owners of Run Try Bike. Thank you for joining us for our Tuesday Instagram Live Fireside Chats. Today we're going to be talking with Dr. Juliana Galante, who I'll invite here in a moment, to join us to talk about empowering pregnant athletes. Fall racing season is here, and maybe some of you women have just found out that you're pregnant and want to have some questions answered. So Dr. Juliana will help us answer those questions. By the way, she was on episode 9 along with Heather. Oh my goodness, I forgot her last name. But she was talked to us about postpartum back in episode 9, and you can find it on our website. Before Juliana joins us, just a couple of concepts or really promotions to discuss with you guys. RTB 20 will get you a 20% discount at Blue 70. That you can go to blue70.com, as well as Second Wind Trail Running is hosting the ABC 50 miler out in San Diego on December 3rd. So take a look at that. We have some posts on our website, on our Instagram account that you can follow there as well and get some information. Great time of the year to run in San Diego. Now to Dr. Juliana Galante. Thank you for joining us again for our second chat with you on our Instagram live fireside chat.
Yeah, thanks so much for having me, Jason. I'm super excited to talk about the pregnant athlete and just kind of dive into some of the questions that our audience has. So,
yeah, and I mentioned that we're on our Instagram live back at episode 9 with Heather Zeman and discussing sort of the postpartum component of it all. For you, the physical activity part; for Heather, the nutritional part. So today we're going to be talking about empowering pregnant athletes. They may have just found out it's fall racing season, right? So potentially they may have just found out, and what do they do in terms of making decisions? So let's just jump right into that, right? So
sure.
If a woman finds out that she's pregnant and she's got a race coming up, so does she have to change her workout routine in the first trimester? How does she know what to adjust? What kind of information can you provide to her?
Yeah, sure. So I think the first thing is, where are you in your pregnancy where are you in your race training schedule when you find out that you're pregnant? So are you finding out you're pregnant and in a month you have the New York City Marathon and you've been training and you feel pretty confident and you're just wondering, hey, is this right for my body? So my recommendation is always talk to your OBGYN and your team and see if training is something that you have to alter right away. So do you have, I kind of call it a red, yellow, or green light to keep training. And they're going to know because they're going to know your extensive medical history. They're going to know if, you have any respiratory issues or if you're a high risk pregnancy. So your doctor and your team is going to say, hey, listen, these are your risk factors based on your medical history. So yes, you can do it, or no, you can't do it. Or, hey, maybe keep working out, but that race at that intensity is not going to work for you. So the first thing you want to do is, if you get pregnant and you're training for an event, is talk to your doctor, review your medical history. And there is research online, and I definitely want to send that over to you, of a red, yellow, and green light system that I follow with my clients. And that kind of says, like, these conditions are yellow light, so proceed with caution. These conditions are red light, so probably not a good idea to continue. So you definitely want to start at that point. If you get the green light and your doctor's like, hey, you're early in your first and second trimester, keep going. And if you're not feeling great, you can always alter your plan. And then sometimes they might say, hey, proceed with a professional who's guiding you and helping you to understand your body during this time. A lot of people in their first trimester sometimes don't feel good. They feel fatigued. Now your body is increasing in its heart rate. You're getting more blood volume to your body. So you might feel more fatigued. You might feel more nauseous. You might feel like you can't lift as heavy. So during that first trimester, you want to think about, is this the time to be pushing myself, or what feels good for my body? Can I continue to do cardio knowing that I have the marathon? We're just going to say a marathon just because New York City's on my mind right now. Coming up next week. So you have the marathon, you've been building a strong foundation, but now you're in your first trimester and you're kind of not feeling too great. You're feeling fatigued, you're feeling nauseous. Doing things for your body that feel good. So not necessarily pushing yourself. And the biggest thing in your first trimester is recovery. You want to make sure you are getting enough sleep, and you want to really listen to your body in terms of, hey, is today a strength training day where I'm lifting heavy, or is today a strength training day where I'm just trying to get movement in? Let me get some body weight squats. Let me do body weight lunges, things like that. And then after your first trimester, or even into a few weeks into your first trimester, if you're feeling like, okay, I got my energy back, I'm feeling good, my body's accommodating to the changes that have already started to occur, because changes happen quick. It's like you don't see anything, but internally things are happening quick. So it's important to, when you're getting your energy back, to not necessarily right away go back to where you were in your training plan. Almost think of it as, ooh, maybe I had a little like speed bump here. So if I was going to run a 10-mile run that weekend, and that was my longest run before I found out I was pregnant and didn't feel good, you might not want to go back to 10 miles right away for your long run. You might want to degress a little bit, go to go 5, 6, see how your body feels, see how your heart rate is, see if you're able to breathe normally during that time, and then kind of progress from there. So did you have any follow-up questions on that? I'm trying to give examples because I feel like it is very variable from person to person.
Well, that's
but I
what
think you want, yeah.
very variable. So when I think about this, right, when we started talking about concept of empowering pregnant athletes, like I didn't put together the timeline component in terms of New York City Marathon is a week from now. Assume they've been training for 16 weeks and
Yeah.
that they were pregnant a week ago or 2 weeks ago. They're at the tail end of their training. They're entering into taper. That's going to be different, right, than somebody who is looking to race at the end of November, beginning of December, and they find out they're pregnant now. Right. So how do the women sort of balance all of that? Right. Like, cause I'm already confused, to be honest with you, as the male. Right?
Yeah.
Like, how do you balance that? Like, in figuring out what it is it just, okay, my body feels this way, and like you said, talk to my team?
Yeah, so first you want to talk to your team and make sure you can compete in the race. That's the first thing. Once you know you can compete in the race, your team is like your medical history. There's no issues for you to keep training. Especially for an experienced athlete, your body has that capacity to compete at a higher level. You just want to make sure you are also listening to your body. You might say, I feel more fatigued during a race, so let me like slow down a little bit. But like in terms of working out during your pregnancy, you can work out at a high intensity if you have been working out at a high intensity. Can you talk while you're working out at that intensity? Because that's really important, because that means you're getting appropriate oxygen and blood flow exchange. If you're like holding your breath when you're biking and you're doing a triathlon, you're pregnant, if you're finding it difficult to really breathe and maybe talk to someone, obviously you're not necessarily talking to someone when you compete, but I always use the talk test as like to gauge your intensity, because there's controversial things on heart rate. Like heart rate is definitely important to monitor, but monitoring it during a race is not necessarily realistic. So I always say, how are you perceiving this exercise? If you have your perceived scale of 0 to 10, which is a RPE scale that will follow, if you're perceiving the exercise as a 5 because you're competing, and you're remaining at a 5 the whole time, that's probably, you're good. You're good to keep going. But if you start to perceive the exercise as 9 and 10, start to slow down, focus on your breathing. If I was with someone, would I be able to talk to them? Do I feel like I could breathe through my nose and out through my mouth? Those are like signs of like, am I pushing myself too hard, or am I like I'm pushing myself, but I could still like, my body could still adjust to that. Does that make sense?
Yeah. And I'd like to stick with the timeline component. So assume an athlete is in a 16-week training program, and
Yep.
they're getting started, right? So they're a couple weeks into it, so they're base building, but they're also happen to be in their first trimester,
Yeah.
and things change, your body's going through changes, and you fall off your routine. Where are they going to pick back up for their training once they start to feel better? Like, is, to your point, like you were saying, high intensity, if they were doing that, is that something they automatically go back to, or do they start base building again?
It's almost not, you're not going all the way back to the beginning, but you're definitely like in the later stages of your base building, going back into, okay, let me build my mileage again. Let me build my strength again. And so I would even argue, go to like if you're not going to the beginning, but like 2 to 3 weeks into your training, go to that weight, go to that distance, see how that feels. If your body's accommodating well, again, thinking about how you're perceiving the exercise, how your recovery is, knowing, okay, the next day, am I super sore? Am I feeling like I'm getting enough sleep? I'm getting enough hydration? Hydrating during pregnancy is so important. And also your training conditions are so important. So you're going to be affected a lot more by heat. You're going to be affected a lot more by cold, mostly by heat, because heat's going to raise your internal body temperature. So you definitely want to be mindful of where you're training to. And I always encourage people to, especially triathletes when they're pregnant, where do you feel the most comfortable? So you find out you're pregnant, you're training for a race, and you're in your first or second trimester. What's the most comfortable for you? Are you more comfortable running, biking, or swimming?
Right.
Okay, you feel the most comfortable swimming, get back in the pool first. See how it feels to swim. See how it feels to go a shorter distance than where you were before you weren't maybe feeling well, or even like if you're feeling great, keep going, keep training through it. The more experienced athlete is less likely to get injured if they continue to progress the way they are, rather than if they stop and then try to get back in where they were. Because it's like anyone, like if I get injured and I'm running, and I'm going to go back to New York City. I did my long run at 16 miles and then I got injured and then I didn't run for a little bit because I was nervous. Should I run? What should I do? And then I'm like, oh, I feel better 2 weeks. I went to PT. Now I'm going to go back and run 16 again. It's like, ooh, okay. Should I do that? Should I start at 10? Maybe I should start, So thinking about it like that, kind of like, there's no specific, like, each person's going to be different, but you definitely want to taper back and then build back up again. But you don't have to go back to square one.
I have a follow-up question to that, but for those of you who are just joining us, thank you very much. My name is Jason Bahamundi. I am the founder and one of the co-owners of Run Try Bike magazine, and today we're talking with Dr. Juliana Galante, who is of Pacer Physical Therapy, and we're discussing empowering pregnant athletes. So one of the things you said earlier about going back, you mentioned distance and weight, and when you said weight, you were talking about strength training weight, not their body weight, correct?
Oh, yeah, yes. Strength training weight. So you almost want to go back to like a 50% of your max before going to like a 75% of your max, right?
Yep, perfect. Mm-hmm. Just wanted to make sure that that was clarified. So if anybody's watching later on afterwards,
yes.
Being super sore and hydrating, which are components to recovery. So how does recovery change after the event? So we're going to keep using the NYC Marathon as our example. So the ladies finish their race, and what does recovery look like at that point during pregnancy for the rest of that time now?
Yeah, sure. So again, it depends where you are in your trimester. So in your first trimester, second trimester, I've even had someone run a half marathon the day before she delivered, and she was great. I mean, she was she was an ultra marathoner. So I know.
For the world, I have to say this as a male, women are tough. They are tougher than men. Period. End of story. Continue with your answer.
Yes, and I just want to clarify, that is not an average person. She was an ultra marathoner, a very experienced runner. She wasn't a professional runner, but very experienced. She's done, 50 milers. She's a fabulous woman. But yeah, half marathon, I pretty much told her, I was like, you probably induced your labor by running. She's like, yeah, I probably did. I felt pretty good though. Because a lot of the times too, you feel so stable because everything is kind of like stretched a little bit and to its max, and it almost makes you feel sort of stable. Depends on the person. But anyway, I'm digressing. Let's go back. So your question was after the event.
Correct.
How does recovery change? So really, it's very similar to the average person. Like, you want to think about this: your liver is going to get affected, your kidneys are going to get affected, your muscles are going to get affected, and you also have a growing little one. So the things to think about when you're running and when you're exerting yourself when you're pregnant: the blood is going away from the baby towards the working muscles. Sounds scary, but it's fine, especially if you've been training the right way. And if you feel like you don't know how to train the right way, that's when I really encourage you to get a coach to really help you, because you don't want to just be throwing darts at a board. You really want to say, hey, let me do this in a methodical way that's going to be safe for my body, by, again, making sure I'm cleared with my doctor, and then making sure that I'm progressing the right way as I become more pregnant. And after your delivery, you want to think about really trying to do double leg, so 2 leg strength training exercises. So I really encourage to decrease the single leg strength training and work on 2-legged exercises like squats, deadlifts, even a sit to stand, where you're like really working on like slowly lowering down and then
Right.
coming up. Just things that you're really just kind of, you're restabilizing everything because your body's been through a big event. And you want to just make sure that you're introducing movement very slowly, but trying to I always say too, like, you can even start to decrease the running a little bit, because it's a single leg activity and your body is going
Right.
through a major change, and you're going to start to get more joint laxity. So things, sometimes a lot of women who I work with, who are continuing to run into their third trimester, will experience just pelvic girdle pain because of that. So a lot of the treatment I'll do is double leg strength training and like inner thigh strength training and core training. So those are things I would focus on. And then same normal recovery, get good sleep, make sure you're eating well, hydrating well, things like that.
For those of you who are watching us, keep in mind what Dr. Juliana just said, which is running is a single leg. I challenge you to try to run with both feet on the ground. It won't happen. It literally will not happen. You'll be standing still. So keep in mind that running is a single activity, and put those exercises in. One thing you said earlier, and this is, you talked about team, you talked about doctor, and you talked about coach. Where do you fit into that circle of team to help, the athletes leading up to their race, post race? Where do you fit into that equation?
Yeah, I think like physical therapists, especially ones who, so I have knowledge in coaching too, like where I'll build strength programs for people. I'm coaching a bunch of people for New York City. I'm so excited. A bunch of them are postpartum, a bunch of them during COVID, didn't race. So it's a lot of people's first race back. It's exciting for me as a coach, but it's exciting for them too. But physical therapists are in a good place where if you have an injury or you are nervous during your pregnancy and you want to work with a physical therapist who really specializes in the fitness athlete, which how you would know that is, one, by their credentials. So a lot of physical therapists who have a strength and conditioning background and who work with pregnant and postpartum women like myself would be someone who would be a good person to turn to say, hey, I am pregnant. I really want to do this race. This is something I really identify with. How do I get there, right? Or a personal trainer who has a background in pregnancy and postpartum, who's really taken advanced courses in that. So there are advanced courses out there that I really like. Brianna Battles has a bunch of great things and resources for even someone who's not in the physical therapy world, even personal trainers and things like that. So even if you're like, hey, I'm curious and I want to learn, she's a great resource. And then Sarah Duval as well, are great resources where if you want to look things up yourself, that's a good place to start. But physical therapists too, what we'll do is we kind of we be proactive as possible with injury, but most of the time I wind up seeing people during their pregnancy because they get injured or because they're hurt or because something's uncomfortable. So, that's unfortunately where we fit in. I love to try to get people before that happens, but so I'll see people again, I'll do a lot of strength training with them to complement their training depending on if they're trained for a marathon or a half marathon or triathlon.
So for those of you who are interested in working with Dr. Galante, she is based in Boston and she does have physical location there, but she also does work with you virtually. And so there are opportunities to reach out to her if you have questions for her after the Instagram Live Fireside Chat, which, by the way, we will post to our website as well as our YouTube channel, and it will also be on our Instagram feed. She was on, as I mentioned earlier, episode 9 with Heather Zeman discussing postpartum recovery and strength training and nutrition. And so this is going to be about empowering the pregnant athlete. So you've discussed strength training. You're a coach. So are there areas that a pregnant athlete should focus on while they're training for an event? Anything specific? What does that look like?
Yeah. Let's pick an event and we can talk about it. Do we want to talk about the marathon?
Yeah, we'll just marathon, and let's just say this is the first trimester, and I had, we're 6 weeks into training, and I find out that I'm pregnant. Am I still focused on running? Do I do more strength training? Do I do more? You mentioned swimming earlier for triathletes. Do they do more cross training type stuff? What does that look like?
Yeah, and again, I think so. I do like I like more combination of cardio and more combination of yes, running, but also like any other type of cross training. So I do like swimming a lot for pregnant athletes because it's just you're getting in the water. It's just things feel lighter sometimes. And it's always, I mean, there's a great study. I think I put it in one of my blogs. I'll have to link that over there. But just about the benefit of swimming when you're pregnant, being able to keep your heart rate a little bit lower in the water. It has a lot of therapeutic benefits. And also, there was a study that came out that your total time during your delivery can be even almost 3 hours less if you are like, yeah, if you're like active and if you're really active during your pregnancy. And especially swimming. And I'm gonna have to link that so that people can kind of look into it more. But yeah, it can help you a lot.
What about
So that's something to keep in mind.
that?
I'm sorry.
What about cycling? Like if you're riding a trainer, because swimming to me, I perceive, I don't perceive it. It is a non-weight bearing activity.
Yes.
And cycling is too, right? Whereas running is weight bearing, right? Because you're pounding the pavement. Does
Yes.
cycling have similar benefits, or is it because of the positioning of being on the bike and being pregnant? Does that cause issues?
Yeah, these are great questions. So I don't know in comparison, let's go back to cycling and swimming. I'm not sure of any of the research of that. I know that there was direct studies on aquatic workouts for pregnant women and showing the benefits of easier delivery, faster delivery, things like that. I don't know if there's any on cycling. I'd have to look that up. But I do know with cycling, position can sometimes feel uncomfortable. So let's talk about how we should change positioning when we're cycling. First of all, cycling outdoors, you want to be careful because obviously there's always the risk of falling.
Right.
So I always encourage women who are pregnant to really think about converting onto an indoor trainer and cycling indoors. So that's really important. And then when you're talking about positioning, right? Sometimes leaning forward doesn't feel comfortable on your pelvis, and especially as you become more pregnant, it doesn't feel comfortable. So I always encourage people to raise the handlebars a little bit. You're going to be a little bit more upright, which might feel odd to you, especially if you're love to cycle and you cycle often. So keeping that in mind ergonomically, it's going to feel a little bit different. And then also we want to think about this for anyone who's cycling is we're not leaning forward from our middle back to reach the handlebars. We are leaning from our pelvis or from our and trying to really lean forward from that position. So we want to be extra mindful of that during pregnancy because I see a lot of people who have extra stiffness and discomfort into their neck and upper back because they're like reaching over, and so that's something I would keep in mind. I really encourage you to lean from your pelvis and not from your upper back and to raise the handlebars so you feel more comfortable. And there's no problems with continuing to do that through your pregnancy as long as you get the green light from your doctor to continue to work out.
So I'm a big believer in yoga and the benefits from a recovery perspective. Is that something that, forget about recovery for the pregnant athlete, but for in the middle of training, is that something that would be beneficial to them as well? Because again, it's non-weight bearing, but it does get your heart rate up, and you work on flexibility, mobility as much as you can. I get it,
Yeah.
right? As much
Yeah.
as you can.
I think I think sometimes, and this is probably a little controversial, but I think sometimes women who are pregnant feel like I need to do yoga or I need to like automatically scale back significantly. And I'm going to tell you this, if you're someone who is very active and you are used to training at a moderate to high intensity, you can continue to do that. Like I said, as long as you get that green light from your doctor, you can continue to do that because your body is used to that. If you are someone who doesn't work out often, is maybe wanting to do their first 5K, and you're like, I just found out I'm pregnant. Should I even do this race anymore? Is it worth it to me? I'm going to tell you this. There is good research that says you should continue to still try to do some type of workout, right? But what feels comfortable for you. So your capacity might be different than someone who's used to working out all the time, but I still encourage you to work out, even if you haven't worked out ever in your pregnancy, because it's going to have a lot of great benefits. The ACOG really recommends 150 minutes a week for the pregnant woman. So, and showing that it's a lot of really beneficial during your pregnancy. It could be really beneficial in your delivery. So that might look like, long walks. That might look like walking uphill on a treadmill. It might look a little different from someone who's used to working out, but I still encourage you to definitely keep moving. Did I answer your question?
Yeah. So I
Okay,
have a
cool.
follow-up to that too, though. So you said very active. Is there a guideline or definition for what very active is? Because some people perceive themselves as being very active, but you, when it comes to pregnancy, might define it differently.
Definitely. So yes, I'm gonna give you some of those resources so people can look at them. It's very easy. It's like black and white. It's pretty much like, how many days a week do you work out? You know, zero to seven.
Right.
How much time are you spending? And then it kind of shows, am I doing a 10-minute workout, a 20-minute workout, a 30,
Okay.
etc. You get what I'm saying, right? And then it kind of says, oh, you fall into this person who's pretty moderate to heavy activity, low to moderate, low, none, etc.
Very cool. And then you said it was an acronym, ACOG? Is that what you said?
American College of OBGYN.
Okay. Just want to
Yeah,
make sure what you were referring to there as well.
yeah, yeah.
Um, we discussed supplements for postpartum um, athletes, in the last discussion. So,
Hmm.
and this goes into the nutrition side a little bit too, which I know is Heather's forte, probably more so than yours. But, for athletes, right, we're used to taking protein shakes or some other sort of multivitamins. As a pregnant athlete, is that something, again, where you're saying, continue to do what you've been doing, talk to your doctor, get your team involved, make sure you're following the information and not just, as you said, throwing a dart throwing a dart at a dartboard.
Yeah, I think so. Most women, it depends, right? I mean, definitely you want to be on a prenatal vitamin. Some women will go on a prenatal vitamin knowing they want to get pregnant, so even before they're pregnant. And then prenatals are obviously going to have tons of great vitamins in there, but sometimes you might want to supplement with a vitamin D. Sometimes you want to supplement with a magnesium. Again, it's very person by person basis. But being on a prenatal is only going to help benefit you during your pregnancy, but also sometimes in your recovery too, because you're getting more of those vitamins that you might have not taken if you were not pregnant. But again, I would refer to your team. They're going to know your medical history. They're going to know how much is too much. They're going to take your blood work. They're going to help you supplement. Iron's really important. Making sure that you're getting enough protein while you're training is really important. But that's really all I can say without it, it's very individual, but yeah, I would consult your team and that'd be a great place to start. And
So
make
you
sure you tell them you're on what medicine, what prenatal you're on, so they can look up too and see like what supplements you're taking in that prenatal.
Yeah, that makes sense because I know for be um, what's the word, very on point when it comes to the stuff that we're putting into our bodies, right? I know I'm taking this, I know I'm taking this, I know I'm taking this. And same thing with the exercises. And so that kind of, when you said red light, yellow earlier, I mean, what do you have an example of what would be an absolute red light for a pregnant athlete to just, absolutely not tap the brakes, but literally put the car in park?
Yeah, so uncontrolled diabetes is one. So, or uncontrolled, sometimes people who have a heart arrhythmia, it can become more severe during your pregnancy. There's like different things that can happen during your pregnancy, like placenta, that like with your placenta, that would be diagnosed through ultrasound. And then also preeclampsia is a big one. That can happen. I've seen that happen to people who are super active. So I think it just depends on, talking to your doctor about that. Your doctor will diagnose you, you'll know. And then when it comes to, diabetes or other health conditions that you might have had prior to, I think it's important to also make sure if you have a specific team that's been helping you with that condition to also consult them about getting their opinion about exercise. And I think it's really important too that you advocate for yourself. Hey, this exercise is really important to me. I really want to make sure I can do this. You're telling me that I need to be extra cautious with my blood sugars if I'm going to exercise when I'm pregnant. Cool. Can you help guide me? Is there things that I should be looking out for? Or is there other professionals that you recommend that I see and consult? And I've worked with women who are pregnant and have gestational diabetes. And I think it's really important to find a good PT who can help you with that, because I've trained people virtually. One of my good friends, I was helping her stay active during her pregnancy, and her sugars were actually so much better because she was active. Where if you get a diagnosis like that, it could be really scary. Like, oh my God, can I do this? Should I just stop? And she kind of was like, I'm going to take a step back. I'm going to start walking. And then I'm going to consult with you. We're going to do some research. I'm going to consult my team. And together, we all came together, and she stayed super active. And it was great for her. I mean, her baby was a normal weight when she delivered. She felt good. She was able to maintain a good weight for herself. So yeah, I think just get your team and make sure you kind of cross-reference people too.
And you said you were a coach, correct?
Yes.
Athletes. So how do you manage the whole idea of paces, right? Because again, we're athletes and we're like, yeah, I'm going to be racing the New York City Marathon, and I've just found out I'm pregnant. So how do those get adjusted? If they're very active, is it just you're going to be fine, keep it going? I guess, and does it depend on trimesters as well? What are all
Yeah,
those?
I mean, yeah, I know it's a lot of moving pieces. It's a lot of moving pieces. Again, I think experience level matters. Experience is important. Are you a very experienced athlete? Is this your first marathon? How is your training background been? These are questions I would ask myself because these are important. What's your base look like when you found out you were pregnant? What is your experience level? Is this your first one? Is this your multiple ones? Are you someone who's really active and maybe this is your first marathon? So that's also
Right.
something to consider, right? Because I would call that inexperienced because it's
Yeah.
you've never done it. So even though you're a very active person, so that's something to keep in mind too. And then in terms of paces, like kind of like what we spoke about before, if you're feeling like 0 to 10 in that RPE, how you're perceiving your exertion is in that 5 to 7 range where you feel like it's a little uncomfortable, but you're okay and you can still breathe in through your nose, out through your mouth. You don't feel like you're holding your breath. You don't feel like you're gasping for air. Keep your peace. You're okay to do that. So
Now we've talked about swimming and cycling as part of recovery. So, and we've given the examples essentially on people running marathons.
yes.
Let's make that a sprint or an Olympic distance triathlon where you can't avoid the swimming and the running part or cycling part of it as part of your event. And now you find out you're pregnant. We discussed changing your handlebar height and that kind of stuff. But are there other components to that in which a pregnant athlete has to figure out how to, I guess, manage, right? Add more
Mhm.
swimming, take cycling off, walk, run less. Like, how do they manage all of that? And again, is it dependent on trimester and their ability?
Yeah. It's pretty much all the same, right? It's depending on where they are in their trimester, where their base was before they found out they were pregnant. And then, yeah, like again, their capacity while they're training. Like, it's not like you need to do less of one thing or do more of the other. If you're not feeling well in your first trimester, you definitely want to ease back into that thing that feels the most comfortable, like we spoke about. But you can pretty much keep going. Like I said, as long as you get that green light. I think if you know the event is going to be in your third trimester,
Okay.
it's probably smart to say, hey, let me see how it goes. But like, you're going to have new changes to your body. And especially if this is your first pregnancy, it's new to you again. So like you might have all the expectations in the world to, hey, I'm a really experienced athlete. I've done tons of triathlons. I feel good to keep doing this even in my third trimester. I know the weather conditions are going to be okay. It's not going to be too hot where I'm, overexerting myself and sweating and my heart rate's going to be up because it might be unsafe during your pregnancy to do that. So you want to be mindful of weather conditions. But I think it's just really good to give yourself grace, to keep trying, but to also understand that this is something new that's happening to your body. So not everything might go as planned, but it is a good idea too. I would definitely think about getting a coach to have someone guide you, especially if you're really determined to, hey, this race was a year ago, then COVID and all the things, I feel like people are even more amped to be like, I want to get back to it. I don't care
Yeah.
for whatever cost, and I get that. Hey, I was there too. I just did my first triathlon. I wanted to do it like 3 or 4 years ago, but then COVID got in the way, all this stuff. So I feel you. I know you're really determined and you really want to do it. But just, yeah, give yourself a little grace and keep the expectations, at a, hey, let me kind of go day by day or week by week and see how I feel, especially if you're thinking about doing a race into your third trimester, which is possible, especially if you're a more experienced athlete.
So I'm gonna preface this with I understand that the experience is gonna be a part, but a marathon, right? Depending on your ability, 4 to 6, maybe 7 hours. A half Ironman, right, is probably going to be, you know, at starting point, if you're really good, 5 hours up to 12. A full Ironman, if you're really good, is 11 hours up to 17. Like if an athlete is in, their first trimester, is it yellow light for either of those two races? If they're in their third trimester, is it red light? Because 17 hours of physical activity just doesn't make any sense whatsoever.
Yeah. Yeah.
Make Dr. Juliana Galante. This is going to be like an abstract answer, but for most,
I know. Listen, I'm going to tell you this. That's a hard question. Do I have to answer that question?
we can jump right to the fun ones.
You definitely do not. The main thing is you do not want to be pushing yourself so much so that your heart rate is just,
Right.
your heart rate starts to fluctuate. I mean, you're really messing with a lot of different factors when you're going for that long. So I would just really make sure you know your pros and your cons when you're thinking about doing that. So
Yeah.
that's all I have to say about that.
As we're talking about, I kept referring to marathons. I'm like, but wait a minute. A half Ironman and an Ironman is going to take a much longer amount of time competing, and you're changing sports throughout that process. And so your heart, right? Because you're swimming, you're at this plane, you're horizontal, and then all of a sudden on a bike, you're slightly more vertical, and then running, you're more vertical. So your heart is also changing the position well. And so how does that impact blood flow, like you mentioned earlier, and how it gets to the extremities, and how does that impact pregnancy? And I get it, right? Like I wasn't trying to be a gotcha question and a full-on answer, but I just want people to understand, like, these things are different events with different time frames. And you've mentioned it multiple times. Get with your team, talk to your coaches, talk to doctors, talk to folks like yourself in PT who specialize in pregnant and postpartum athletes, because that's going to be the answer.
Yeah, and especially if you're in your first like 25 weeks, you're going to be more successful in completing your events just because of where you are in your pregnancy. Getting into the third trimester, it's dicey and it's so individual dependent, which is why I really encourage you to get with your team and really see where you're at. Everyone was giving I forget who that woman was. She was in the Olympics and she was pregnant. Do you remember who that athlete was?
No.
But there was I remember this was like a few years back, and not this past Olympics, I think the one before that. I can't remember. But I'm sure if you Googled pregnant Olympian, you would see, because it was like this huge thing, like, oh my God, can she be doing this when she's pregnant? And I mean, this woman is used to competing at these high levels. And we also need to remember, we're talking about some people who are, the 1%. So everyone keep this in mind too. I think the average person, which I'm an average person too. Hi.
Yeah.
25 weeks and less is going to feel more manageable to do an event. So after that time, if you're noticing it's feeling more challenging, that's normal. If you're noticing, hey, maybe I need to reschedule this event to next year, I'm going to just keep working on strength training. I'm going to keep working on things that feel good for my body, maybe doing more swimming or cardio. See how you feel. Like, some people can run into their third trimester and they're fine. Some people just don't feel comfortable. you know?
Right.
And it's
Yep.
more of like, is it worth me not feeling comfortable? It's not necessarily that you're in pain, but you maybe just don't feel comfortable. So yeah, kind of playing that by ear, but also knowing where you're falling in your pregnancy and how you're able to tolerate the load that you're placing on your body.
Gotcha. Very cool. So we're 40 minutes into this. I know we try to keep these to about 40, 45 minutes.
Yeah,
Where can
sure.
people find you? How can they get in touch with you if they have questions that we didn't touch base on today?
Yeah, sure. So you can go to pacerphysicaltherapy.com. I'm still offering some discovery calls, which means you can jump on a call with me. We can talk about, what you're looking for. So I work with women in clinic in Boston. So if you're in the area and you want to come in, I do physical therapy and I do coaching. So my coaching is something where if you don't have pain, but you want to continue to be active during your pregnancy, or if you just need guidance, I have a pregnancy program where we'll meet for 5 visits during your pregnancy. So it's usually like 1 in your first trimester, 1 or 2 in your second trimester, and 1 or 2 in your third trimester. And I help you also with birth prep. So how can I minimize tearing when I deliver? What positions can I what positions can I be in during delivery? How can I talk to my team about maybe trying some of those things, because they're going to help aid in my recovery and maybe not be as uncomfortable. So that's what a session would kind of look like during your pregnancy. So you can go on a discovery call with me. We can chat more about what you're looking for. And I also offer virtual coaching as well. So I've coached a bunch of people during their pregnancy, just helping them stay active and alter how they're lifting and what their goals are and how to kind of still manage and get there even as they progress through their pregnancy.
Very awesome. So the
Yes.
last time we talked, we did do the rapid fire questions. So there are some that you guys can go check out from episode 9. So we've got some other ones for you, and I'd love to hear your answers on these. So Halloween is coming up really fast. Favorite candy to get as a kid during Halloween was?
Ooh, favorite candy. I think probably a Kit Kat, which now is definitely changed, but Kit Kat.
What's the favorite candy to get now?
I like a Sour Patch.
Oh, that's a big change.
Yeah.
What's the candy as a kid that when you emptied out the bucket, you just threw across the room because you're like, no way, I'm not eating this?
Malt balls for sure. Get rid of those.
Whoppers are
What was that?
Whoppers, they're out. Those Whoppers, because those are like chocolate malt balls. I don't know if you've ever seen. Can you not hear me anymore?
I lost you for a second, but now I can. Yes, sorry.
Whoppers, right? Whoppers are those chocolate malt balls that they
Yeah.
sold. Um, the bag of candy I got from my students has tons of them, and I'm with you. Like, just throw them to the side. They're unnecessary.
Nah, I hate them. Yeah.
What about today? What are you throwing across the room today? Still Whoppers? Still malt balls?
Probably still Whoppers. Probably still Whoppers. I do enjoy candy corn more.
No, no.
I know.
I
It's a controversial thing.
read a description that said it was something like biting into a cube of sugar that tastes like Elmer's glue.
Don't ruin it for me. I don't eat it all the time, okay?
There's let's get your take on this. So there was a tweet I saw that said 100% do not include these in the handouts for Halloween. Candy corn, Peeps, circus peanuts, and red vines. What percentage of those are like, yeah, I can hand those out?
I'll tell you right now, Peeps is a 0. I am not giving any kid a Peep. I do not like Peeps. But I would give people candy corn.
What about red vines?
I don't know if I know what red vines are.
Yeah, Twizzlers, basically.
Oh, okay. Yeah, I don't mind Twizzlers.
The red one, but what about the black licorice one?
You're pushing it, okay, Jason.
Red, and then the styrofoam circus peanuts. Remember those?
Yeah. Yeah, I'd probably go candy corn, peanuts, then red vines, then yeah, Peeps for sure. That's my order.
Kids today don't know how good they have it when they're getting handed Snickers bars constantly and
I
Twix.
know. I also would love, honestly, hey, if you're in Boston, go trick or treating. I would love to have some trick or treaters. I got candy, so
There you go.
I just want more kids to like enjoy trick or treating. I feel like a lot of people don't anymore, so controversial reasons, but hey, I hope kids get out and go trick or treating. Go to a trunk or treat. Those are fun too.
Those are
I took
fun.
my niece. I took my niece to one.
And do you eat meat?
I do.
Do you enjoy barbecue?
I do.
So Texas style, North Carolina style, Memphis style, or North Carolina? Did I say Carolina? Carolina style?
Um, Memphis.
Memphis, a little
Yeah,
dry.
a little more dry rub stuff. Yeah.
I don't eat meat anymore, but when I was, dry rub was definitely the way to go. Like
Yeah.
just the whole idea of getting your hands all wet and I'm not.
Yeah. I'll eat them all. Believe me, I'll eat them all.
I'm not that picky.
Yeah, I'm not really not picky with
I
food.
did ask preference.
Yeah, yeah, yeah.
Was it like, one or the other?
Yeah, totally.
So in terms of reading, you
Mm.
answered the question last time, favorite book. What are you reading today to kind of get away from the everyday?
Yeah. I'm in a slump right now. I think I told you before we jumped on. I'm just so crazy busy, and I was on this good roll of like one book a month, which for me was a lot. Okay, and I was feeling really proud. I was on this streak, and I broke my streak this month, and I'm so
Oh,
sad. So I need to jump back on it next month. So I'm looking for my next book. I was in a big fiction
okay.
vibe, but now I think I'm kind of leaning toward a good nonfiction book. So I'm looking, I'm searching. I have a few books out there that I'm like are on my list, but I'm like, what's next? If anyone has any suggestions, let me know.
So I'm reading the Moscow. I don't know if you're into history. So from a nonfiction perspective, it's all about the Cold War and how the CIA and spies played a role
Ooh.
in the Cold War. It's fascinating. Like it almost reads like it's nonfiction. Honestly, it's
Oh,
amazing.
okay. Yeah, because if it's not too dense, I'm cool with that. So.
Yeah, no, spies penetrated, Moscow and how, what they had to do. And so it kind of it seriously reads like a
Oh,
nonfiction to make it a
yeah,
movie.
totally.
Um, it
Cool.
was the authors for Argo. I don't know if you saw Argo with Ben
Oh
Affleck.
yeah, yeah, yeah.
The authors of Argo wrote this book. So it kind of comes from
Nice.
fiction.
Cool.
So what's next for you? We're coming up to the end of the year. You did your first triathlon earlier this year. You've now
Yep.
gotten business is booming. What's coming? What
What's next? I know. Next is honestly, I'm in like coach mode right now, so I'm not necessarily really focusing too much on myself, which I hope to do after coach mode is over with all these New York City runners that I'm coaching, and I'm super excited to watch next weekend. But I think what's next is I'm really just trying to keep expanding, getting the word out there about, advocating for women's health. I really want to start joining the Massachusetts chapter to get more PTs to see women early post C-section. I've been seeing a lot more women after C-section. It's a major abdominal surgery, and I don't think women post C-section get enough information and help and support, I should say, in their recovery. So I'm really trying to advocate more for women in that aspect, in that sector, so that they feel good when they get back to, exercise and just day-to-day routine, because it's a major thing that I think doesn't get enough attention. So I'm really pushing to advocate into that population, and yeah, just kind of rolling through the day-to-day, Jason.
that's Thank
Yeah.
you so much. These are our conversations that are always so informative for me, and I know they are for the audience. And we'll get you back on here once you get through the whole coaching scenario here. I know New York City Marathon's in a week from now, but we'll get you back on and have more conversations because I think it's an important topic that needs
Yeah.
to be discussed more often and brought to light. So thank you so much for joining us, and we'll talk to you again soon.
Yeah, sounds good. Thank you so much for having me. Great to talk to you. Bye.